Our physical health is affected by a wide range of factors. Both health and illness are determined by a complex interaction among genetic, psychological and social factors. The attitudes and beliefs that we have about our health and our lifestyle play a very important role in our health. Many researches show the important role of our behavior in our health. Since social psychology studies topics which are closely linked to lifestyle like coping with stress, attitudes and beliefs, social support, etc., it can contribute a lot to the understanding of the factors affecting health and well-being. Health psychology is the branch of applied psychology that is concerned with examining the role of psychological factors in physical health. The classic definition of health psychology is concerned with promoting good health habits and preventing illness. Studying psychological factors that influence our likelihood of becoming ill and how those suffering from particular illnesses can benefit from knowledge from psychology. It also enables us to examine how health care can be provided to the people in the best possible way. According to Matarazzo and Taylor, health psychology considers four main areas: promoting and maintaining health, preventing and treating illness, identifying the causes and correlates of health and of illness and other dysfunctions, and improving healthcare system and formation of health policy. Due to medical and technological advancements, people in today's world are living longer. However, very few people are completely free of disease. Many people suffer from chronic illnesses such as hypertension, diabetes and heart disease. Psychology helps to understand and manage psychological aspects of living with chronic illnesses so that patients can enjoy a better quality of life. Biomedical model of health and illness by Bryan and Feist is the theoretical framework which led to many medical advances leading to the understanding and cure of a number of life-threatening diseases. The biomedical model is based on the idea that illness can be completely explained by understanding the biological functioning of an organism. The biomedical model also tends to focus on disease more than on health, and it conceptualizes health as the absence of disease. In contrast to the biomedical model, the biopsychosocial model sees health as being determined by biological, psychological and social factors. Health psychology understands health as a biopsychosocial process. A person's state of health is a complex interaction of biological factors such as a genetic predisposition to a particular disease, psychological factors like stress, and social factors such as socio-economic status. Social psychology and health. Health psychology is an area of applied social psychology. Many of the principles of health promotion and health behavior change are based on social psychological theories and concepts. Socio-economic factors such as income and educational level play an important role in our health and illness. Our interactions with our physicians and other healthcare providers are examples of social relationships, and the nature of these interactions has an important effect on our health outcomes. Social factors also influence how we cope with illness or stress. In general, the presence of others has beneficial effects on our health. The support we receive from our loved ones helps us to feel better, adopt healthier behaviors, and help us in dealing with stress. However, it is also likely that the social influence of other people can have negative effects on us. Health attitudes and health behaviors. Health behaviors are actions undertaken by healthy people to enhance or maintain their good health. These behaviors include consuming healthful foods, getting regular exercise, avoiding the use of tobacco, alcohol and drugs, getting adequate sleep, using seat belts, using sunscreen, controlling weight and making use of health screening programs. Genetic factors play a very important role in how long we are going to live and how healthy we will be in our life. But environmental factors too play a very important role. The attitudes that we hold about our health are really crucial. Many studies have also shown that attitudes related to health do not exert a direct influence on health generating behaviors. Rather, such effects operate through attributions and self-efficacy. The practice of health behavior centers on 5 sets of beliefs according to Bandura and others. General health values including interest in health and concern about health. The perception that the threat to health posed by a disorder or disease is severe. A belief in personal vulnerability to a disorder or disease. A belief that one can perform the response necessary to reduce the threat, that is self-efficacy. A belief that the response will be effective in overcoming the threat, that is response efficacy. Eisen and Fishin gave the reasoned action model, which talks about another attitudinal component that predicts social behavior. The theory of reasoned action maintains that a behavior is a direct result of a behavioral intention. Beliefs about one's sense of self-efficacy are also important in the practice of health behaviors. Self-efficacy predicts behavior such as exercise, diet change, etc. Changing health attitudes. Persuasion and social influence in media health coverage. Social influence refers to phenomena when interactions with other people can lead to changes in our attitudes, beliefs, values and behavior. Any type of intervention can be considered as a form of social influence. Persuasion refers to a specific kind of social influence in which a particular message or appeal is used to try to change someone's attitudes or beliefs. There are 2 different kinds of persuasive messages: informational appeals and fear appeals. Family, peer and school influences. An individual is influenced by people around him or her. The family, peers, school, etc. have immense influence on the life of an individual, especially his health behaviors. Culture and health behaviors. Most of the interventions designed to change people's negative health behaviors are targeted at the individual. But health habits are also embedded in the dynamics of social relationships, and so the family unit has been considered as the context for changing poor health habits and encouraging good ones. Such an approach is especially successful in collectivist cultures. Symptoms and illness. Being ill or healthy is both a social and a psychological process. To think of oneself as ill, one must notice symptoms, which is a psychological process depending on focusing attention. Situational factors influence whether a person directs his attention inward or outward. People's expectations affect symptom information. Mood influences the experience of symptoms. Obesity. There has been an alarming increase in the prevalence of obesity in recent decades. Obesity increases the risk of heart disease, bone disease, and many other illnesses. This recent increase in the number of obese people raises the question as to why this is so. Genetic factors play a very important role in this regard. Our ancestors experienced alternating periods of plenty and famine. However, due to technology and new inventions, we can store foods for greater lengths of time, and hence we do not experience such alternating periods. Environmental factors also play a very important role here. In recent years, the size of portions of many foods has increased dramatically. Many restaurants have increased their portion size. Social factors also play a very important role. Walking has become less as compared to past years. Media campaigns have become very attractive for food items high in calories. Stress, illness and coping. Stress is a negative emotional experience accompanied by predictable physiological, biochemical and behavioral changes that are designed to reduce or adapt to the stressor, either by manipulating the situation to alter the stressor or by accommodating its effects. Stress plays a very important role in health and illness. Stressful life experiences and the ways people cope with those stressful events also have an impact on health and illness. Lazarus and Folkman's approach is known as the transactional model of stress. The basic idea of their model is that the experience of stress results from ongoing transactions between people and the environment. During the course of these transactions, people encounter particular situations, events, or people that may or may not induce stress in them. These are referred to as stressors in Lazarus and Folkman's transactional model. Based on their encounters with stressful events, people make an appraisal, that is, a judgment as to how to respond to the stressors. After the appraisal of a situation as being stressful, people go to the third stage of the model, where they evaluate their coping options to resources to deal with the problem. Negative events cause psychological distress and produce physical symptoms in people. Uncontrollable events are more stressful than controllable or predictable ones. How stress can cause illness? The experience of stress is a problem for people not only because it produces emotional distress and physiological strain, but also because over time it may lay the groundwork for illness. Coping is the process of attempting to manage demands that are viewed as taxing or exceeding our resources, according to Lazarus and Folkman. Coping is a dynamic process. Coping begins with the appraisals that people make of the situations with which they have to cope. These appraisals are crucial to subsequent efforts to manage the stressful situation. Generally, researchers distinguish between two types of coping efforts: problem-solving efforts and efforts at emotional regulation. With problem-focused coping, people deal directly with the problem that has caused them to be stressed. Problem-solving efforts are attempts to do something to change the stressful circumstances. Emotion-focused coping involves people trying to regulate their emotions so that they can minimize the distress caused by the situation. Emotion-focused coping involves efforts to regulate or work through one's emotional reactions to the stressful event. Positive coping resources. Dispositional optimism is a general belief that more good than bad outcomes will occur in life. Such optimism may enable people to appraise stressful events more positively and to mobilize their resources to take direct action in response to a stressor. Hardiness is a set of attitudes that make people stress resistant. Hardiness includes a sense of commitment, positive response to challenge, and an internal sense of control. Penn Baker and his colleagues have suggested that catharsis may have psychological benefits. Importance of social support. Social support refers to the resources that we get from other people. Social support also involves the size of our social network and the number of links that we have with other people. Recent work by health psychologists indicates that socially supportive relationships moderate the effects of stress, help people cope with stress, and enhance health. Social support can take many forms. We get emotional support from others who provide us with love, empathy, and security. When others let us know that we are valued and are accepted despite our faults, we receive esteem support. Practical help that we receive from others, such as lending money and helping out with our chores, is referred to as tangible or instrumental support. Informational support refers to getting advice, suggestions, or feedback from others. Finally, we get network support when we feel a sense of membership in a group that shares our interests or provides us with social companionship. Changing health behavior. Some of the most influential theories related to change in health behaviors are the health belief model, the theory of planned behavior, and the stages of change model. The health belief model. A number of factors influence whether people will practice healthy behaviors, including demographic factors, early socialization of health habits, emotional factors, access to the healthcare system, and cognitive factors. Cognitive factors such as beliefs about how likely it is that we may become ill, and also our perceptions of how likely it is that particular health practices might promote health or prevent illness. The health belief model deals with these cognitions and how they predict people's health protective behaviors. According to the health belief model, the actions we take to enhance our health are influenced by a number of factors like general health values, perceived susceptibility to illness, perceptions of illness severity, self-efficacy, etc. The theory of planned behavior. According to the theory of planned behavior by Eisen, the way to change people's behavior is to alter their behavioral intentions. Behavioral intentions are the best predictors of what people will do. For people to adopt healthier behaviors, they have to change their behavioral intentions. According to the theory of planned behavior, behavioral intentions are influenced by three things: attitudes toward the behavior, subjective norms regarding the behavior, and perceived behavioral control. The stages of change model. Prochaska and De Clemente developed the stages of change model to deal with individual differences in changing health behaviors. According to this model, people can be classified as being in one of the 5 stages with respect to making a particular health behavior change: pre-contemplation, contemplation, preparation, action, or maintenance. Promoting health and preventing illness. Health promotion refers to efforts made to encourage people to engage in healthy behaviors such as eating a healthy and balanced diet, exercising regularly, getting enough rest, and refraining from smoking and abusing alcohol. Prevention refers to efforts to reduce the probability of getting an illness or to reduce the severity of an illness or disorder since it occurs. Primary prevention. Prevention efforts that are aimed toward healthy individuals so as to keep them healthy and avoid the risk of contracting diseases. Secondary prevention occurs later when people are already affected by a disorder and the goal is to prevent the condition from leading to more severe health consequences. Tertiary prevention. Situations in which the disease or disorder has not been prevented but efforts are made to reduce the extent of the disorder's impact on the patients. To summarize, since social psychology studies topics which are closely linked to lifestyle like coping with stress, attitudes and beliefs, social support, etc., it can contribute a lot to the understanding of factors affecting health and well-being. Health psychology is the branch of applied psychology that is concerned with examining the role of psychological factors in physical health. Health psychology understands health as a biopsychosocial process. Health behaviors are actions undertaken by healthy people to enhance or maintain their good health. The practice of health behavior centers on 5 sets of beliefs. The theory of reasoned action maintains that a behavior is a direct result of a behavioral intention. Persuasive messages that increase feelings of vulnerability as well as increase feelings of self-efficacy and response efficacy might induce people to modify their behaviors. Obesity increases the risk of heart disease, bone disease, and many other illnesses. Folkman defines stress as a particular relationship between the person and the environment that is appraised by the person as taxing or exceeding his or her well-being. Repeated exposure to stressful events and repeated subjection to the physiological changes occurring due to stress like increases in blood pressure, blood sugar level and respiration has adverse effects on the functioning of our physiological systems. Coping is the process of attempting to manage demands that are viewed as taxing or exceeding our resources. Coping could be problem-focused, emotion-focused and avoidant. Positive coping resources include dispositional optimism, hardiness, etc. Social support refers to the resources that we get from other people. Some of the most influential theories related to change in health behaviors are the health belief model, the theory of planned behavior and the stages of change model. Health promotion refers to efforts made to encourage people to engage in healthy behaviors such as eating a healthy and balanced diet, exercising regularly, getting enough rest and refraining from smoking and abusing alcohol. Prevention refers to efforts to reduce the probability of getting an illness or to reduce the severity of an illness or disorder once it occurs.